Good morning, everybody. Welcome to Seton Hall University's virtual open house. So glad you could be with us today. My name is Dr. Alyssa McLeod. I'm the Vice President of Enrollment Management here at the university, and I'm going to be sharing information with you today about the Joint MD program. I do also want to ask two of my colleagues to introduce themselves. These colleagues will be monitoring the chat throughout my presentation so that they can respond to questions while I'm talking, but I will also take questions at the end. So I'm going to turn the floor over to Derek and ask him to please introduce himself to all of you, and then we'll go over to Katie.
Hi, everyone. My name is Derek Martinez. I'm Assistant Vice President of Enrollment Management for Marketing Communications. I've been with Seton Hall for 10 years now, and I am an alum. So I'm very happy that you are all joining us today.
Hi, everybody. Welcome to Seton Hall University. My name is Katie McCarthy. I'm an Assistant Vice President of Enrollment Management for Operations, and I'm also an alum at Seton Hall, and I have been working at Seton Hall for the last 9 years.
Wonderful. Well, thank you all for giving your Saturday afternoon to be with us today. I am going to share my screen with you, and I did also want to let you all know that this presentation is being recorded, just so you're all aware of that. Okay, great. Want to make sure you can all see my screen now. Yes?
Yes, we can.
Wonderful. Okay, so you're here today to learn about the Joint Bachelors MD program. It's a BS or BA to MD program, and it's a very unique program. It actually allows students to earn their bachelor's degree from Seton Hall and also earn an MD degree from Hackensack Meridian Health School of Medicine. And the School of Medicine is actually a very new School of Medicine. It actually opened in 2018, and it was a partnership between Seton Hall and Hackensack Meridian Health System. We were actually the partner in helping to get their accreditation off the ground, write the curriculum, and get everything set up for the new curriculum. And then in 2020, as part of our planned partnership, we shifted accreditation to Hackensack Meridian Health. But we still have a very tight partnership with them in many ways, which I'll talk about, including our interprofessional health sciences campus, which is not only home to the School of Medicine, but also the College of Nursing and the School of Health and Medical Sciences. So this partnership has some amazing benefits. Most importantly, it creates a real interprofessional learning environment. It allows students from all the different medical disciplines. So not only the School of Medicine, but also the College of Nursing and the School of Health and Medical Sciences, which is things like PT and PA and interprofessional health sciences and occupational therapy and speech language, all of these different disciplines to work together collaboratively for better healthcare outcomes. And this is really innovative. Very few organizations have this kind of cross-fertilization of disciplines and ideas so that students can be well-rounded and understand healthcare and delivery of health in many different perspectives and how to work with your partners. We do have many joint grants between the School of Medicine and Seton Hall's College of Nursing and School of Health and Medical Sciences, grants on things like cancer research, the opioid epidemic, things related to stroke, traumatic brain injury. So all of these things are really going to benefit students who get this broad perspective. One of the most important benefits of our relationship with Hackensack Meridian School of Medicine is that 25% of the seats in the School of Medicine are reserved exclusively for qualified Seton Hall graduates. And I'll talk about that a little bit later, but that's a real benefit of this program. Also, as part of this program, this partnership with Hackensack, we did establish the Joint MD program, which you're here to learn about today. And this program serves as a pathway to the School of Medicine. And it's anticipated that that 25% reservation of seats, the majority of those students will come from this Joint MD pipeline, as I'll explain later. But before I do that, I want to talk to you a little bit about Hackensack Meridian Health itself. For those of you who don't know this system, it is one of the most comprehensive integrated healthcare networks in New Jersey. It's highly reputable. If you're from New Jersey, I don't need to tell you that. You know that it's one of the best systems. If you're not from New Jersey, it really is ranked one of the top. They have 16 hospitals, which include 3 academic medical centers, 2 children's hospitals, 9 community hospitals, and 2 rehab hospitals. They have 450 patient care centers around the state, and they have over 33,000 team members, including 6,500 physicians. They're known as a leader in cancer care and cancer research in the state of New Jersey, and 3 of the hospitals in the Hackensack network are ranked in the top 10 in the state of New Jersey. The School of Medicine, as I said, opened in 2018, and the incoming cohort, so each year they bring in a new cohort of students, and that cohort always starts in July. So the incoming cohort for the School of Medicine is generally 150 to 160 students each July. And just so you know, they started the School of Medicine in a preliminary accreditation status in April of 2018. It is typical that every brand new medical school starts in a preliminary accreditation status and then moves 4 years later to full accreditation, which we are on track to get and should be received probably in the end of this month. But again, that's the routine path for all schools of medicine that are brand new. Where will you study when you're part of this program? So when you are doing your first portion of the program, which is your undergraduate bachelor's degree, you'll be on Seton Hall South Orange campus. Beautiful campus, 14 miles from New York City, in a very lovely suburban town of South Orange, New Jersey. And you'll live on campus. You'll have, if you want to, you'll have lots of activities to get involved in. And then when you transition to the MD portion of the program, you're going to move on to the School of Medicine, which is on our Interprofessional Health Sciences campus. So let me tell you a little bit about the Interprofessional Health Science campus. It's actually in the towns of Clifton and Nutley. It's a brand new, renovated, state-of-the-art facility. It's about 30 minutes from Seton Hall's main campus in South Orange. It's also 30 minutes from Hackensack Meridian Health's flagship hospital, which is Hackensack Medical Center, and also 30 minutes from New York City. So it's really an optimal location. And again, this is the home to not only the School of Medicine, but Seton Hall's very own College of Nursing and School of Health and Medical Sciences. And this interprofessional learning environment really helps students thrive. You know, when you get into the field of medicine and you start becoming a doctor, you'll actually have to work collaboratively with nurses, with PAs and with PTs on treatment plans. And this is really designed to create a team-based approach to help you understand the continuity of care and learn to work with other providers. So if you were to visit the campus, which I encourage you to do, we give tours on Fridays during the school year, but over the summer it will be on Mondays. You will see the facility. It's a wonderful facility. I'm also going to ask my colleagues to drop in the chat a link to the video to look at the Interprofessional Health Sciences campus. They can also drop in the chat a link to look at a video about the main South Orange campus so you can see both. But one of the things that you'll recognize, especially if you watch the video about the Interprofessional Health Sciences campus, is that the curriculum and the education is really set up for collaboration. So for example, you might be in a simulation lab doing a mock surgery, performing maybe an appendectomy or something on a mannequin. And while you're doing that, standing alongside you is a nursing student who's also participating in the simulation as their part of the process as a nurse. And then afterwards, you might see patients in a clinical setting where you're talking to them, and you might have a PA student join you so that you can really get to see both perspectives. And that's a very unique approach to education that very few schools can offer. And it's really going to help you be able to improve patient care and outcomes and really be on the cutting edge of healthcare provider. So the Joint Bachelors MD program. So actually this program is designed so during the first 4 years, you're going to complete your bachelor's degree at Seton Hall, and you can actually major in any subject you want. Biology is the subject that's most aligned with the prerequisite courses you'll need, but you can actually major in any subject. Regardless of what you major in, you're obviously going to have to take intensive science courses. You can't become a doctor without a strong foundation in the sciences. And we will make sure you take all the courses you need to stay on track with your prerequisites. The benefit of majoring in any subject is really that you don't have to give up your passion. You can pursue medicine, get the strong foundation in sciences, but you can also have a double major or a minor. You can still fit in a study abroad program or join the honors program or the leadership program, really allowing you to pursue all of your interests. And medical schools like to see people with diverse backgrounds and academic backgrounds. This is different than many other joint MD programs. Many other joint MD programs are 3 years, and they rush the undergrad, which means that you don't get to maybe have as traditional or robust of a college experience. And we want to make sure you have some fun and are able to explore other topics while you're preparing for medical school. When you apply to the university, you have to make sure that on the application itself, you select the box that says Medicine Joint MD Program. That it's important that you select that. That's how we'll know that you're applying to this program. And for those of you who are juniors, our application for next year opens on August 1st. In terms of, sorry about that. In terms of choosing your major, so you're going to spend the first 4 years, again, completing your bachelor's degree at Seton Hall. Just so you know, when you apply, we assume that you are going to inherit a biology curriculum, but you can major in anything you want. And once you're admitted and you deposit to the university, then in early May, after the deposit deadline, we'll reach out to you to ask what major you want to be, and we'll update your record. So if any of you are seniors right now, you've probably just received that. But regardless of what major you choose, you're always part of the Joint MD program. Being part of the Joint MD program, regardless of what your major is, means that you have to take certain prerequisite courses while you're studying in the bachelor's degree program. And on the screen in front of you is a list of those prerequisites. These are pretty typical prerequisites. This is not only to get into the Hackensack Meridian Health School of Medicine, but really to get into any school of medicine. And you'll see that you have to take 3 semesters of some humanities and social sciences, like philosophy and psychology and history and criminal justice, sort of things that make you well-rounded. You're going to have to take 2 semesters of biology, and you're going to have to take 2 semesters of chemistry, both with labs. You're going to have to take some other science courses as listed here. You will have to take English, math. You will have to also take courses like ethics and leadership and maybe some foreign language. You have some choice, some flexibility here. One of the questions we often get is about students who have taken AP courses in high school. So maybe you took an AP math course or an AP English course, and you want to know if you're going to get credit for those. So yeah, you will get credit for those at Seton Hall if you earn a 4 or higher, but they might not necessarily waive you out of this course. That would be true no matter where you went to college, because most medical schools do not want to see an AP course given as credit for a prerequisite like this. So you will probably have to retake the course at the university, but you would still have the credit to cover some electives. So pre-med advising. So everybody who's part of the Joint MD program is also pre-med. So if you are in the Joint MD program, you are also pre-med. But not everybody who's pre-med is part of the Joint MD program, because as I'm going to explain in a little while, to get into this program, the criteria are a little bit more difficult. So this program has all the benefits of being pre-med plus more. But let me tell you what it means in terms of support. You're going to have a dedicated advisor who is going to work with you all 4 years. They're going to be there to ensure that you take all the appropriate courses, that you take all the prereqs, that you stay on track to graduate on time. They're going to help you select your major or pick a minor, give you guidance on studying abroad if that's something you're interested in. They're also going to do things like provide you with a series of different workshops and guest speakers designed to help you get a deeper knowledge about the medical field. So we have often surgeons who visit, recent alum who are currently in medical school. We have observed surgeries. So lots of opportunities for students to have workshops, and those start very quickly in your freshman year. They'll also connect you to resources on campus like tutoring and study groups and time management workshops. They're going to mentor you and give you guidance about what kind of extracurricular activities you should be involved in, because in order to get into medical school, you do have to make the most of your undergraduate experience, and that means making sure your application is very strong with lots of things such as research or internships or publications or shadowing doctors, working with different populations or doing community service. So your pre-med advisor is going to work closely with you to make sure that you achieve some of these extracurricular activities, and we'll even try to pair you up with doctors to shadow or give you guidance on internships. You also have a career advisor in the Career Center who will help you. So there's lots of different ways that you can participate in all of these activities. There are also lots of activities for preparing for the MCAT, like study groups, and those start being available to you very early. You can start in as a freshman if you want to, taking advantage of MCAT prep courses. They will also, your pre-med advisor will also help you identify medical schools you might want to apply to. Even though you might be applying to the Joint MD program, it doesn't mean you have to go to the Hackensack Meridian School of Medicine. You can actually go wherever you want. So all of the guidance you're going to get from the pre-med advisor is to help you with the med school application process so that you can have a wide variety of choices. They're also going to help you prepare for your interviews. And they're going to, help you with your essays, your recommendations, all of those kind of things. Your advisor is also going to keep track of your performance and let you know if you fail to meet the conditions of the Joint MD program, because once you're in, you have to do certain things like get certain grades, and I'll go over those later, to stay in the program. And they're going to make sure you meet all those conditions. And if you don't, then they'll let you know that you're not on track and you can't stay in the program. You can still get pre-med advising, you can still apply to the Hackensack Meridian School of Medicine, but you're not going to get some of the benefits of the program, which I'm going to explain in a little bit. So what I'd like to do right now is actually share a video with you from one of our students who could not be with us today. She's a junior in the Joint MD program, and I asked her to just record a quick little video on her thoughts about her pre-med advisor and the things she's been able to do. So I would like to share this with you right now. So enjoy.
Hello everyone, my name is Ashley Basaski and I'm a junior in the Joint MD program studying biology and medical humanities, and I'm from Westfield, New Jersey. My pre-med experience here at Seton Hall University has been so enriching. I've constantly felt supported throughout my entire journey, starting day one, because the first day I came onto campus, I already had 3 advisors. I had my freshman advisor, my peer advisor, and my pre-med advisor. My peer advisor and my freshman advisor were there to ensure that my transition from high school to college was seamless and provided me the resources in order to have a successful first semester in college. And then my pre-med advisor was there to ensure that I had everything set and ready to go every single year in order to apply to medical school. So all of these advisors work together to ensure that I'm a successful college student and also will be successful when I'm applying to medical school. A great thing about these advisors is that they constantly alert us students about opportunities to help enhance our applications for medical school. So as soon as my freshman year, I was going to volunteering opportunities, guest lecturers with physicians, MCAT workshops, you name it. My advisors were constantly keeping me in the loop and making sure that I was doing these enriching activities as soon as my freshman year. Some of these activities that I have done include research, community service. I've gone on mission trips, I've shadowed physicians, worked in hospitals, you name it. So first I'm going to talk about research. I started research as soon as my freshman year, yes, which is pretty unheard of in the college scene. However, at Seton Hall University, if you want to do research, you can do research and you can start as soon as your freshman year. And you're not going to be a lab rat. You're not going to be sitting in lab, cleaning test tubes, watching other people do the assays. No, it's going to be you doing the work. So as soon as my freshman year, I already was designing my own procedure and running my experiments. And by where I am now, junior year, I already have a publication. I've presented at national conferences and I've even won money for my research, which is, again, unheard of, but it's so great to have because Seton Hall is a medium school, but has a small school feel. So you'll be able to pursue opportunities that you want to do and you won't be limited by that. Another opportunity that was very enriching for me as a pre-med was going to these guest lecturers. As soon as my freshman year, we constantly had physicians coming in to speak about what it's like being an anesthesiologist, what it's like being a family medicine doctor, etc., etc. And having these guest lectures was very enriching because it helped reinforce that, oh, I would want to maybe consider doing anesthesiology one day, or again, like family medicine. These guest lectures were really great opportunities for us to not only just hear from physicians, but connect with them as well. So from these guest lectures, I was able to connect with that anesthesiologist, and I was able to even shadow her afterwards, which is amazing. And I was able to do that my freshman year. Another activity that I have involved myself in a lot in college is community service. On campus, we have the Division of Volunteer Efforts, or DOVE, and that just coordinates all of the volunteering opportunities on campus and off campus, and I do provide transportation for that. So in DOVE, I've participated in volunteering at a garlic farm, I've done graveyard cleanup, I volunteered at a home for people with cerebral palsy, I've even gone on a mission trip to Appalachia. I've done quite a lot of volunteering opportunities because it's something that I genuinely love to do, and Seton Hall has provided many community service opportunities for me to participate in. Constantly throughout my entire undergraduate career, I have felt the utmost support from my advisors, my faculty, and my peers. And I'm so glad that I chose Seton Hall University and Seton Hall's Joint MD program to pursue my pre-med journey. Thank you. Hello, everyone. My name is
Wonderful. So I hope that hearing Ashley's story was helpful for you to see the type of support that you would get from Seton Hall advisors and faculty, and the types of opportunities, especially to engage in things like research very early on in your academic career. That is really a unique feature of Seton Hall. Many universities reserve research for seniors or graduate students, but we firmly believe in providing those opportunities very early on in your freshman year, and that really helps you stand out in the pre-med application process. And many students have research that starts in freshman year and continues on into their junior and even senior year. So that's really one of the differentiators here at Seton Hall. Now, to be part of the Joint MD program, it is a rigorous program, and it does require that you've done well in high school. So you have to have a minimum of a 3.6 GPA in high school. This would be an unweighted GPA. So if your GPA is weighted, we will unweight it. So a 3.6, and you also have to have taken the test, either an ACT or an SAT. Seton Hall is test optional, but this is the only program that is not a test optional program. You will have to submit either an ACT or an SAT, and your ACT has to be a 30 or higher, or your SAT has to be a 14 or higher, 1400 or higher, with not less than 650 on either section. And you can take the test as many times as you want. We do super score the highest ACT or SAT. And again, to apply to the program, you have to make sure you select Medicine Joint Bachelors MD program on the application. That's the Seton Hall app or the Common App. This program only offers a start in the fall, and it's not open to transfer students or international students. These criteria are very strict. I'm often asked, well, what if I'm just 10 points off on the SAT, or what if my GPA is just a little off? These are very strict. So it is important that if you're taking the SAT or the ACT, you make sure you get that and retake it if needed. These are the criteria for this fall and next fall. They may change in subsequent years as we monitor the program. Our program is a little different than most joint bachelor's MD programs. Many schools offer a joint program, but they require you to major in biology or science. They usually also have much more stringent admissions criteria. It might be like a 1540 on the SAT, or a 34 ACT and a 3.9 GPA. So they're a lot more strict and difficult to get into. They also only admit a few students every year, maybe 3 to 5 students a year. And long ago, I worked at an institution like this where they only admitted 3 or 4 people a year to their joint program. And by the end, really nobody made it to the medical school. It's a very small pipeline. That's not our program. Our program is very different. It's actually designed to create access and give more opportunity to students. And we can do that because of our partnership with Hackensack and the fact that we have this guaranteed 25% of the seats for our students, for our graduates, if they're qualified. The program is also different in that it's much more flexible. It allows you to major in whatever you want. Again, so you don't have to give up things you love. I know students who are in the Joint MD program who are majoring in physics and minoring in music or majoring in business and minoring in biology. I know students who've studied abroad who are in the honors program or the leadership program, who are involved in student government or are part of a sorority or fraternity, because we're not trying to rush and condense everything. We don't think that's good for your overall experience or your mental health. These are very difficult classes. This is a serious program, so we want you to be able to do well, but also have the time to enjoy your college experience. Again, the requirements for our admission are less stringent than they are for a typical program. And again, the fact that we have this 25% reservation of seats is very unique and is what allows us to do that. The other distinction is that this program is not guaranteeing you a seat in the School of Medicine. It's guaranteeing you an interview with the School of Medicine. Now, that's actually a big deal. For those of you who know anyone who's applied to medical school, you know that you cannot get into medical school without doing an interview. An interview is required for every medical school. But usually there are thousands and thousands of applications to a medical school, and only about 15% of people actually get selected to have an interview. So this program is guaranteeing you that interview. So really helping you jump to the front of the line and be a candidate who gets to be in front of the medical school. Now, it's giving you this pathway. When you couple that guaranteed interview with the fact that 25% of the seats in the School of Medicine are reserved for our qualified students, you're really in a strong position, but you have to do your part. You have to keep your grades up. You have to, take advantage of all of the workshops and write a good essay and practice for your interview and all the things we're going to support you with along the way. So just to recap for you, a typical program, you have to major in biology. Our program, you can major in anything. The number of students admitted for a typical program is 3 to 5. This program does not have a minimum because we know based on the admissions criteria that we set that we'll be admitting an appropriate number of students to make sure that we bring in the cohort size that we need. And I'll explain that a little later. Again, a typical program might guarantee you a seat if you meet all the conditions, and ours is only guaranteeing the interview. And the admissions criteria are typically much more stringent for a typical program as opposed to ours. Also, a typical program would be 3 years of bachelor's degree and 4 years of medical school. Ours is the opposite. It's 4 years of bachelor's and potentially 3 years at medical school, but perhaps 4 depending on your chosen course, which I'll explain later as well. So once you get in the program, obviously you have to keep up your grades, right? You don't just stay in the program because you were admitted. You have to make sure that you get certain grades. So you have to have a cumulative of 3.5 GPA at the end of your freshman year, a 3.6 at the end of your sophomore year, and then a 3.7 in the 2 subsequent years. You have to earn at least a B or better in all of the prerequisites on your first attempt. You still have to take the MCAT and you have to get in the top 20%, which right now is about a 510. You have to take that in September of your senior year at Seton Hall. And you are allowed to retake the MCAT to improve your scores, and they will look at multiple scores. Many students start taking them in the latter half of their junior year. And again, we have a lot of preparation and support for that. You must still apply to the medical school. All medical schools in the country use the same application. It's kind of like a common app for medical school. And you should apply by November 1st. You have to do all of the things they ask, right? Write an essay, submit recommendations. They ask some supplemental questions. You have to make sure you do everything that they ask. You also have to make sure you have New Jersey residency before the end of your junior year. If you're from New Jersey, that's great. You already have it. If you're not from New Jersey, it's not very difficult to establish residency. You just have to get a driver's license in New Jersey, which is very possible if you rent an apartment in the area. And I will say that the large majority of our students in their sophomore and or junior year wind up renting apartments in town with their friends, because it's actually a little bit more affordable and nicer than our residence hall. So it's very, very common that students do this. And these apartments are all within like 4 or 5 blocks walking distance from campus. So it's really like an extension of campus. And then of course, you're going to have a successful interview with the School of Medicine in the fall of your senior year. And during that interview, there's a lot of factors that will be considered, which I'm going to review in just one moment. And then of course, during your undergraduate time, you have to make sure that you don't do anything unethical or illegal that would, prohibit you from becoming a doctor. So when we say that seats in the School of Medicine are reserved for 25% of Seton Hall graduates. I want to be clear that these students must meet all the qualifications of the medical school. So the goal of this program is not to let subpar students go to the School of Medicine. The School of Medicine is a rigorous school. They want quality applicants. And we're admitting you with the assumption that you will be a quality applicant because of your profile in high school and because of all the support we're going to give you during your 4 years. But I just want you to be clear that you can't get into the School of Medicine if you don't meet all the conditions that were outlined a few slides ago. You do need to maintain those GPAs. You do need to take all those courses and do well. But more importantly, when they look at your application, they're not only going to be looking at your MCAT scores and your grades, but they're going to be looking holistically at your whole record. That means looking at your essay, your recommendations, any secondary questions they asked. And of course, they're going to be, talking to you in the interview. And it's not so much about, of course, it's important that you're articulate and well-spoken, but what's more important is that you have substantial things to talk about that show your readiness and your fitness for medical school. And that you can demonstrate that in your essay, your recommendations, and your interview itself. So what does that mean? Well, that means availing yourself of all of the things that we've spoken about. It means making sure you do research or publications or attend conferences with faculty, making sure that you do some kind of volunteer work, clinical work or hospital work or nursing home, soup kitchen. It's important that you try to do some kind of internship in a medical field. Maybe you work as an EMT or a scribe in a medical setting, that you do some type of shadowing or observing in a medical setting. Medical school, especially Hackensack, cares a lot about your exposure to diverse populations. They want to make sure that you are sensitive to the needs of different communities. So they're going to want to see study abroad, volunteer abroad, or working and supporting diverse communities locally. All of these things are very important. So your academic advisor and your pre-med advisor are going to work with you during the 4 years to make sure that you have a robust college experience with many of these factors so that you can have a strong resume, a strong interview, a strong essay. And these are the things that help keep you qualified, in addition to keeping your grades up, studying and doing well on the MCAT, which we also prepare you for. So there's no reason you shouldn't be able to be successful if you take advantage of all of these things. But ultimately, it is up to the student in terms of how seriously they take their essay, their recommendation, and how well they do on the interview. And we do give a lot of prep for that. When the School of Medicine is interviewing you, they're going to be looking at a lot of attributes also that are not necessarily as obvious on paper, like your emotional intelligence, your servant leadership, your integrity, your passion for the field of medicine, your motivation, adaptability, how good are you at taking initiative? What are your oral and written communication skills like? So all of those things are very important. And those are definitely things that you'll practice with your pre-med advisor as you practice for the interview itself. And again, being able to support your passion for the field of medicine or your ability to be adaptable with actual examples of things that you've done while you were an undergrad. If you are granted a seat in the School of Medicine, here are a few things you should know about the School of Medicine curriculum. It's a very innovative curriculum. First off, every student will take a course called Human Dimensions of Health. This is a 3-year longitudinal project where a pair of students in the School of Medicine will be paired up with a local family. And this is a pretty innovative approach, but it's so that you will work with this local family over the entire course of your medical school education. So you can understand determinants of health, what kind of conditions like biological and genetic and environmental or socioeconomic, access to food, access to transportation. How do these things determine health outcomes? And it's important as a practitioner that you understand this bigger scope so you can really serve your patients and know what their needs or what their impediments might be. The school also has a community assessment where 6 to 8 students are paired up. And they actually work with some kind of township or community entity or civic leaders, public health officials, to also look at the needs of a society or a local community. So it could be working with a school board on nutrition for kids. It could be working on a diabetes clinic with a diabetes clinic in a neighborhood, or with a local health official to educate people about the flu or COVID or something like that. So we'd be pairing students so that you not only get the ground level perspective of the families in the human dimensions of health, but then you add to that this community layer of education and outreach. And then every student in the School of Medicine is also required to do scholarship requirement. This is not scholarships as in money, but scholarships as in scholarly work and research. So you will be required to have some kind of advanced clinicals, or you engage in research with doctors from Hackensack or with Seton Hall. And this is embedded as a part of the School of Medicine so that you'll all make sure you have that. Now, you would probably already have that from your undergraduate time, but the medical school also provides that. And then another unique feature of the School of Medicine is what we call phase 3 of the program. And that gives you sort of an individualized path, which I'll talk about in a moment. Curriculum-wise, phase 1, all your standard courses, like all the instructional foundational things you need. It starts in July, it goes straight through for 16 months. You're going to be doing things like immunity and cancer and infection, neuroscience and behavior. While you're doing this, you're going to start immediately working in our simulation labs and doing lots of practice clinicals with mock patients and with mannequins. And you're going to be focusing on learning about lots of other things at that same time, like substance abuse and mental health, and learning about continuity of health and healthcare outcomes in general. So this is all the foundational stuff. Then you switch to phase 2, which we call immersion. This is actually your real hands-on clerkships or clinical rotations, if you will. It's 20 months. And as you can see, in the first part, you do these 8 or 12-week rotations in different areas: surgery, family medicine, pediatrics, OBG, etc. Not necessarily in this order. Everybody will have their own order, but you will have all of these clerkships. Step 1 is sort of a big exam, small vacation. And then you start doing your advanced clinical rotations. This is where you start doing rotations in elective fields that you're interested in. And you would work with the School of Medicine on this when you enter the phase 1 of the medical school. They'll start working with you on that. And then phase 3 is what's called individualized. So by the time you get to the end of phase 2, you've actually finished all the actual required coursework that is required in the School of Medicine. And it's very condensed. Most medical schools are 4 years. Everything I just explained up till now is 3, but with really no breaks. You go straight through from the summer to the fall. So it's a lot more condensed. And we changed it to a 3-year model on the recommendation of the American Medical Association, which believed that a 3-year model might be a better model moving forward in the future. Since we were writing a new curriculum, we followed that. And we believe other schools will start to follow suit eventually, but rewriting a curriculum is a heavy lift. So after the 3rd year, students have a few choices. They can actually begin their residency within the Hackensack Meridian system if they would like to. What Hackensack has indicated that they will do is if a student, so when you do your residency, what happens is you have to have a list of places you want to do your residency, and you rank the hospitals that you're interested in. And then the hospital has to rank the students they're interested in. So what they have said they will do is if you rank Hackensack on your list, they will rank you on their list. So you will have a match and you can begin your residency at the end of your 3rd year. No guarantee about your specialization, but that is a really, really good benefit that you can start your residency at the end of 3 years. Might be a little bit more difficulty to start a residency outside of the Hackensack system because it's, again, not the norm, a 3-year medical school. Students can try, but if they opt not to do the Hackensack residency, there's other things they can get involved in, like a global health immersion or intensive research, intensive clinical. There are also some joint degree or joint certification programs with Seton Hall, like nonprofit management or an MBA or a law degree or a global health management certificate, healthcare administration, population health, practice management, just some of the other thoughts about joint degree opportunities we have for students. In terms of scholarships, when you're admitted to Seton Hall, at the same time you're notified of your admission, you'll also be notified whether or not you qualify for a scholarship, and everybody who meets the admissions criteria for this program should receive a nice scholarship from Seton Hall. They're automatic, you don't have to apply, they're renewable for all 4 years, but they do not extend to the graduate MD portion of the program. They're only for the first 4 years. as far as any scholarships for your time at the School of Medicine, there's no guarantee you're going to get them. They do offer some scholarships. They are competitive. What I can tell you is that Hackensack Meridian Health has established a $100 million endowment specifically set up to provide scholarships to students in the School of Medicine. So you have an opportunity to apply for scholarships, but you should go into this knowing there's no guarantees. I'm going to open it up for questions in a minute, but let me just walk you through a few quick things. So I covered this earlier, but do we accept AP or college credits? Yes, we do, for 4 or above, C or better if they're from a college, but just a reminder that these might not waive you out of the course, like out of a biology course or a math course. Instead, they might just count as electives. What happens if you complete your degree in 3.5 years or 4.5 years? That's fine. You might finish faster because you came in with a lot of elective credits or you took a lot of summer classes at the university. You might graduate in 4.5 years because you got really involved in other activities, you studied abroad for a whole semester, or you changed your major or something like that. It's not a problem if you graduate in 3.5 or 4 years, but it is important that you know that the School of Medicine only starts their cohort in July. So if you finish in mid-year, which would be December, you still have to wait until July for the School of Medicine to begin, which is not a problem. You just know that you have a few months to, do something else while you wait. Do you have to attend the Hackensack Meridian School of Medicine if you're admitted after your interview? No, you do not. Many students who are in the program choose to go to other medical schools. This is a very good opportunity to go to a wonderful medical school with one of the most reputable hospital networks in the state, but it is certainly not your only option. Can you be in the Joint MD program and also be in honors or leadership or maybe be an athlete? Absolutely. There's no reason you can't do those, although they are not necessarily the things that will strengthen your application. Honors especially, people think that they have to be in honors to look good to medical school. That's not really the case. It's more important that you engage in research and shadowing doctors and all of those things I discussed earlier. But if you want to be in honors or leadership because you have an interest, you can balance that with this program because of the 4-year nature. How many students can be admitted to this program? Well, as I said earlier, there's no cap and there's no limit. We admit anybody with the 3.6 and the 30 or the 1400, obviously assuming that you also have good essays and recommendations and no red flags on your record. You have a decent curriculum. We're going to look at those things as well. But basically, if you meet these criteria, there's no reason that you won't be admitted. And people often ask, well, how is that possible? Well, that's possible because we have a good handle on the numbers. So just a reminder, the School of Medicine has an incoming cohort of 160 students. 25% of those seats, 40 seats, are reserved for qualified Seton Hall students. Typically, we have about 50 or 60 Joint MD students entering each year as freshmen. Now, that's people who enter. That's not how many people we admitted. We often admit, 4 or 5 times that, because not everybody who gets admitted chooses to come to the university, right? Certain people, you'll all be applying to multiple colleges and universities. So we know based on historical data, how many people we can admit and what a typical size is. About 25 to 30 of those students, about half of them will not take a seat in the School of Medicine for various reasons. They could have left Seton Hall, they could have changed their majors, maybe they didn't meet the requirements, maybe they got into other medical schools. Let me tell you what's happened so far. So, and this is the question everybody has, so everybody wants to listen to this carefully. So the question I always get, well, what happened to the students who graduated so far? So this program only started in 2018, brand new program. And when it started in April. So we didn't actually recruit for it. So our first cohort was super small. We basically just went to some of our students who already deposited and said, hey, do you want to be part of this program? So the first cohort started with 10 students. Those 10 students are graduating now. Of those 10, 2 dropped out of the program. Could be they left Seton Hall, could be that they didn't keep up the grades to stay in the program and they didn't follow through and stay in the Joint MD program. So that leaves 8. 3 of those 8 opted not to apply to the School of Medicine because they already applied to and got into other medical schools and they chose to go to those medical schools. So they opted not to apply to Hackensack. That leaves 5 students left. Of those 5, all of them were granted the interview with the School of Medicine. 4 of them were admitted to the School of Medicine, and 1 was not. So obviously it's a small sample size, but it gives you a sense of the pipeline and how things move forward. So that is the formal end to my presentation. I know there are some questions in the chat, so and maybe some other questions. So Katie, would you mind reading me some of the questions?
Sure, Alyssa. The first question is the difference between regular pre-med students and the Joint MD students is that the Joint MD students get the guaranteed interview?
Very perceptive. Whoever that person is, you're going to do great in life. Yes, that is the big differentiator. So if you are in the Joint MD program, you're guaranteed the interview, and the pre-med students are not. So you're going to get the same advisement, the same support. Although I would say the Joint MD program, just by the nature of their admissions criteria, tend to get some of the better shadowing opportunities and better internships because they tend to be higher caliber performers. But the real difference is that the interview is guaranteed for people in the Joint MD program, and it's not guaranteed for the pre-med students. Now, that doesn't mean pre-med students can't apply to the School of Medicine, can't have an interview, and can't get in. That can certainly happen. They just don't have that sort of certainty in their back pocket, if you will.
Sure. You just answered the last question with how many students from the 2018 cohort have matriculated. We have another question of, are there additional essays required to be admitted to this program from the freshman year?
No, so to be admitted from high school, it's the same application process as it is for all students at Seton Hall. So exactly as our website explains, the only thing that's different is that this program is not eligible for test optional admission. This is the only program where you must submit SAT and ACT scores, but everything else about the application process is the same.
Sure. What are we looking for in an applicant for this program?
So if you apply to this program from high school, we're going to be looking again at your grades. We want to see a 3.6 or higher. That's again unweighted, a 30 ACT or a 1400 SAT with not less than 650 on one section. We are going to read your essay. We don't have a specific essay question that you have to answer. What we really want to do is get to know you a little bit better. So you should write about anything that's important to you, whether it's you know, an experience you had, a reason why you want the field of medicine, or a subject that you like. There's really nothing wrong that you can write about. What's important is that you write well, right? You have to proofread it and take it seriously. Also, we really like to see that you have a point or a message, right? So that you have a clear beginning, middle, and end, and that you have like woven throughout that a message that you're communicating, whether it's, you know, why the field of medicine is important to you, or why you love to read, or why, you know, an illness that a family member went through has been so impactful in your life. Just have like a central message. Don't just jump around aimlessly. Although I find people who are admissible to this program based on their grades and test scores tend to be able to write decent essays. We also need your recommendations to be strong. So we couldn't have a recommendation from a guidance counselor or a teacher that was negative and said bad things. And also we couldn't see any serious behavioral issues like selling drugs or you know, being suspended for, you know, serious fighting or serious issues. So we want to see that you're you know, a good steward of your education and a member of the community. So pretty much a holistic approach, but the grades and the test scores are the most important. We will also look at your curriculum.
Do you have an idea of how the course load would look for students coming in with various college credits, like the different courses that they would be taking, and how that would go with studying for the MCAT?
Yeah, so we do have a lot of students who enter this program and the university in general who come in with a significant number of credits. And it generally means that they take some more, in your case, you still have a lot of prerequisites, right? So you're going to have to make sure you take all of the different prerequisites, but it does give you a little more latitude to take on subjects that you're interested in. But if you do meet all the prerequisite courses and you meet the 120 credits to graduate, you can graduate early. We do have students that graduate early. and sometimes they graduate early and maybe they had an internship already, so they just continue the internship after school, because again, you have to wait until July to start at the School of Medicine. I think I know of one student who graduated in 3 years, not from this program, but in general, because they brought in a lot of college credits. So that is possible. But I also want to encourage you to not rush too much. You only live once. College is a great time in your life. And I see students sometimes try to take on too much and cause themselves to be overwhelmed and stressed out and not have maybe the right attention on their well-being and mental health. And we don't want to put that pressure on you. That's why it's a 4-year program. It's no joke, classes in college, right? They're not like high school classes. There will be a lot of work and a lot of studying. So just a word of FYI there.
Alyssa, what kind of research opportunities are available for freshmen?
So there's lots of opportunities. I've heard this story anecdotally from dozens of students over the years. It's not difficult to get research on campus. All of you will probably be taking some type of science course in your first semester. And almost every single student I've talked to got their research project by walking up to their professor at the end of the class and saying, I'd really like to do research. And then the faculty will say, well, what are you interested in? And they'll have a conversation, and the faculty will tell the student what kind of research they're doing. And if the student is interested, this faculty will say, great, let me get you set up to do research with me. And if the student is interested in something that faculty doesn't do, the faculty will say, well, my colleague is studying brain injury or studying diabetes. And they might introduce you to their colleague and get you set up in that way. My understanding from every student and faculty I've talked to is there's really no reason you're not going to get research at the university, unless the following exists. So you will not get a research project if you miss a lot of classes. So if you are in a biology or a chemistry class and you skip 20% of the classes, your faculty is not going to want to give you a research project. If you don't participate in class, if you don't hand in your homework, but if you're a good student who's showing up, who's taking the course serious, who's asking questions, who's doing your homework, you don't have to do perfect. They know that it's a struggle, but you have to put in the effort. If students do that, I've never seen a student not get a research project if they do their part, because we really, really believe in that hands-on learning and exposing people to that early. Katie, are there more questions?
Sure, sorry, you froze for a second on my end, Alyssa, I apologize. Can you talk about the any residency matches with the current graduating class from the School of Medicine? Do you know any of that details?
I don't actually know that data. They're actually graduating their, they graduated their first class last year because it was a 3-year course. I do believe several of them, it was a smaller cohort for them. They did not start with 160 students in their incoming class. They started with 40 or 50 because they also built up. But I do believe several of them started residencies at Hackensack, but I don't know the specializations, and others opted to do an additional year of some other type of research or joint degree so that they could be more competitive for residencies outside of Hackensack. But again, that was their choice. They could have started a residency in Hackensack if they wanted to, but maybe they wanted to do a residency at a different hospital or closer to their home, or in a specialization that they were not able to get at Hackensack, although Hackensack does have almost every specialization that exists because they have such an extensive network of hospitals, but it's competitive to get the exact specialization you want.
How can a student better prepare in high school? Are there recommended courses and activities that we suggest a student does in high school?
So that's a great question. I think it's important you take your science and math classes seriously and you do well on those. Those will give you the right foundation so you can handle the coursework when you get here. I think doing community service or volunteer work, especially in a medical related field, like it could be a nursing home, it could be working on cerebral palsy or with senior citizens in a nursing home. So something that shows like a dedication to helping people would be very valuable. Of course, some students in high school are scribes or EMTs or volunteer at a hospital. So any of those things would be helpful. But even if you don't have those things, it's not a requirement to get into the program, but it is going to help you, hit the ground running and have a good baseline to do well in the program.
And then this one was sent to me privately, but how difficult is it to major in something else? Are you getting the right advising if, say, you wanted to major in something other than the biology or the sciences?
Yeah, it's very easy. That's why it's a 4-year program. We have many students who are majoring in other subjects. One student in business, one student in computer science, one in interprofessional health sciences, some in social work. So other areas of science like physics, one person in English, one person in communication. So it's very possible to major in whatever you want. Just know that you're still going to have to take all those prerequisites, which are science intensive, right? So you'll still have a lot of science intensive courses, but you can still major in other subjects. Also, our School of Diplomacy and International Relations, you could do global health management. Some of these curriculums in these other programs are flexible enough that you can use some of those, you can sort of use those credits for both and still major in another subject. So your advisors are very adept at that. They'll guide you through, what majors make the most sense. And, to be honest with you, you might come in with one idea and change your mind after, a semester or two. And that's also why the flexibility is helpful.
Sure. Thank you. And then we just have, it looks like, one final question. During the School of Medicine interview, is there different weightage for medical research versus research in other STEM areas? And then just to follow up with that, can students study abroad in this program?
Yeah, so I don't believe the School of Medicine is weighting any particular type of experience as more or less important than another. It's more how you speak to it, how it helped inform your understanding of medicine, your advocacy for patients, your interest in the field of medicine. So, they want to see that you've had a well-rounded, robust experience and that you've had some exposure to things that legitimately give you an interest in medicine and demonstrate a seriousness, but it's not really one thing versus another. In fact, one student is doing research that, when I say research, you think about biology or chemistry or physics, but I have a student who's doing data analytics research with our computer science department because they're trying to look at anomalies and outcomes for certain types of patients and certain types of medicine. So that's not necessarily the kind of research that comes to your mind, but that has a place in the field of medicine, a very valuable one. So it's not that one thing is more important than the other, just that you could speak to why it's valuable to you and what you learn from it. In terms of study abroad, and I saw another question pop up about study abroad, so I'll speak to both. It is definitely possible to study abroad. The university has many different types of study abroad options. We have a lot of short-term programs where it might be 2 or 3 weeks at our Rome Connection program at the end of the spring semester. It could be a winter session where you go for a few weeks over winter break. It could be a whole summer. We do have a medical brigades program, which is less of a study abroad and more of a volunteer abroad. They've gone to El Salvador and the Philippines to work with nurses, to do clinics, to do blood drives. The study abroads vary every year. It depends what faculty are offering in that given semester. But I also want you to know that you don't only have to participate in a study abroad program that's run by our faculty. You can find any study abroad program out there run by any university or run by any organization and just tell your advisor, I'd like to do this program. And the advisor will look at all the courses, advise you what's the best thing to take and work that into your curriculum and your sequence. So there's really no limit to where you can study abroad. Generally, if you were to study abroad for an entire year, I'm not saying that's not possible, but that would be difficult, but a whole semester, not a problem. But a lot of people tend to do, maybe they do a short 4 weeks over the summer and then they do like a 2 or 3 weeks over the winter. People tend to like that because they want to be on campus and be with their friends.
Thank you. We had another question that was sent to me directly is regarding AP exams. Would that be taken into consideration if they were slightly off on the SAT or the SAT strict requirement?
No. So I mean, the AP exams will make your overall application look stronger, but you still have to have the 3.6 unweighted GPA and you still have the test scores. Those things are very strict. We can't drop below that GPA or those test scores. Everything else is more subjective review, right? Like essay and recommendations and curriculum has a lot more flexibility, but those two items are pretty set in stone. So Katie, if we have one more question, I'll take one more and then I'm going to wrap it up and say good night, good afternoon, and have a great day to everybody.
Looks like we're all caught up in the chat.
Well, I thank you all for being a wonderful audience. I appreciate you giving your Saturday afternoon, and please feel free to contact us if you have other questions. You could call 1-800-THE-HALL, or you can visit thehall@shu.edu, and we'll answer any questions. I know it's a lot of information. We did also record this webinar, and we will send it to all of you who participated in the middle of next week, so you have a record that you can listen to again if you'd like. Have a great afternoon, everybody. Thank you.
Take care, everybody.